Welcome to NeuroNights. NeuroNights is for anyone who wants to learn more about brain injury survivors, research, and clinical care. Thank you and enjoy the episode.
Welcome to NeuroNights. My name is Kedar Hiremath, and I am here with Drs. Sean Rose and Kelly McNally from Nationwide Children's Hospital. So, Sean and Kelly, thank you for coming and doing this.
You're welcome.
Thanks for having us.
Yeah.
So let's just get started to get to know you a little bit better. So, Kelly, let's start with you. Tell us a little bit about your training. What's your position at Children's, and why did you get into this work?
Yeah. So I am what's called the Pediatric Neuropsychologist. And so a lot of people may not even be familiar with what that is as a career. So a neuropsychologist is a clinical psychologist. So we go to grad school for clinical psychology and then have specialty training, really focusing on brain behavior relationships. I work with kids specifically in pediatrics, but working with kids to better understand how a brain condition, a neurologic condition, a brain injury can affect their behavior. And that includes things like cognition. So we do a lot of assessments and testing of things like memory, attention, processing, general reasoning skills, as it might relate to different neurologic conditions. So I specifically focus on concussion. And so with that, Dr. Rose and I are the co-directors of our complex concussion clinic at Nationwide Children's. And we focus on seeing kids if they're having persisting symptoms after a concussion. And my role specifically is to do both assessment. So often that's looking at their cognitive skills. So looking at memory, attention, processing, or other general learning difficulties that they may have, but also assessing things like mood and behavior, sleep, and other aspects of their lives that can be affected after concussion, and then coming up with a management plan, and then working with kids to kind of help support their behaviors that might lead to a more favorable outcome after their injury.
Hey, I'm Sean Rose. So I am a pediatric neurologist who focuses in sports neurology. So after med school, I did a residency in pediatric neurology, and then I did a fellowship in sports neurology, so mostly working with athletes and concussion management. I currently work at Nationwide Children's, and as Kelly mentioned, we co-direct the complex concussion clinic. So I spend a lot of my clinical care time helping patients with concussion, but also do a fair amount of research in concussion too.
Great. So, in one sense, we're kind of identifying what's going on with these kids and then thinking about not just the cognition and behavior components of it, but probably the underlying neurological components as well. So if someone comes into your clinic, what's sort of the process that they undergo?
So our clinic specifically focuses on seeing the kids that maybe went through the traditional concussion care and for one reason or another just didn't get better, right? And they had persisting symptoms. So we're not usually seeing people in our specific clinic that are kind of coming right from the emergency room or, usually they've had some type of concussion care and then they're just having persisting symptoms. So the typical kid with concussion might just get managed, whether that's by their pediatrician or their athletic trainer or our sports medicine clinic or a physical medicine clinic. So they might get managed elsewhere, but then we're kind of focusing on the kids who might have persisting symptoms. So when they get to us, their first appointment is a pretty in-depth evaluation. So all of the kids that we see for our first appointment are going to see a neuropsychologist. So usually that's me or one of the fellows working with me, and we do assessments of their cognitive function and then look at behavioral and emotional factors that might be contributing to things. Then they see our physical therapist who does a vestibular evaluation and looks at other physical aspects that might be contributing to their recovery. And then they see Sean, who does a neurologic evaluation. And you can talk a little bit about your role.
My visit is more of a standard medical visit. So, first we want to make sure that we have the right diagnosis. So a concussion is actually kind of tricky to diagnose. Most people just kind of think if you get hit and then have some symptoms afterwards that it's a concussion. But we really do expect there to be enough of a force, enough of an impact that would cause a brain injury, which is what a concussion is. And then a typical onset of symptoms, usually within the first 24 hours of the injury. So first we confirm the diagnosis and then talk through current symptoms and the trajectory of those symptoms and put that into context of their previous medical history. Were they someone who had already already experienced a lot of migraines or difficulties with mood or anxiety before the injury. And then we do a neurologic exam. And then the great thing about working in a multidisciplinary clinic is that I get to put together the plan from everyone. So, I incorporate the cognitive testing that Dr. McNally did, incorporate the physical therapy evaluation, and then my own evaluation into an overall plan, attacking the symptoms usually from multiple angles.
And we're talking to each other throughout that day too. So I think the nice thing is just that collaboration across different providers, just really in the moment where we can all kind of be going back and forth and really coming up with a plan from lots of different angles.
So do you find like you're doing a lot of education? What's their level of awareness of what's going on?
Yeah, we do usually provide a lot of education. So a new patient visit in our clinic is 3 hours long.
Wow.
Each part of the visit is an hour long, and there's 3 parts. And so, we're reviewing, the emotional and behavioral aspects of the injury and their recovery, the different physical aspects, how that fits in with their previous experience with symptoms, and how that fits in with their current, tolerance of school and activities. And so we do find that there's a lot of information that we can pass along to patients and their families. And even though they have received some concussion care, usually very good concussion care, when the symptoms are persisting, we can really put it into a context that helps them move forward.
And I would just add, concussions are tricky, right? If you look at the list of symptoms that go along with concussion, it's headache, not feeling right, irritable, feeling tired. So the symptoms are just very common in the general population and not specific to concussion, and can be caused by lots of different factors. I feel bad sometimes because it's like it is a 3-hour appointment, but in some cases we could spend more, right? It takes a long time to really try to break this down and try to disentangle that and figure out targets for how we can move forward.
It sounds like, the confirmation of that concussion versus, again, just something else that may be going on with that person, pretty critical. What about the time course? So they've had a concussion. You said sort of maybe a month has gone by. What's been that month for them?
Really variable, right? And I think that's, again, part of what makes it so difficult is how individualized, how it affects people differently, I guess I should say. So, we have some kids that we might be seeing them 3-4 weeks out. And in some cases, maybe they really haven't been back to school very much. And then, missing 3 weeks of school, that's really hard to come back from. Yeah. And you can develop school avoidance and not want to go back and have a lot of anxiety around that. That's rare though. Typically, I think concussion management has really changed a lot over the past, say, 10 years. And so, it used to be stay at home, stay in a dark room, right. Do that until you get better. And then that's what was happening, right? Kids were staying home from school. They weren't seeing their friends. They weren't doing any exercise, and they weren't just living their lives. And that in of itself can cause a lot of problems, right? Where you're just withdrawing, your sleep gets, very inconsistent. You can develop reactive depression and anxiety. And, there was a lot of negative impacts of really kind of that cocoon therapy or dark room therapy. And now really the initial management has shifted, right? And that's a period of relative rest and gradually getting back into things. But that can look very differently just depending on how significant the symptoms have impacted any one individual. So hopefully by the time they see us, they're back in school, but sometimes it's still inconsistent, or they might be, feeling like they need to go to the nurse a lot. A lot of times, again, they're not cleared for sports participation yet, and that's part of what we're doing to figure out when they're safe to do that. And then it has a big social impact, like you mentioned as well. So a lot of the kids that we're seeing are athletes, and so then you're saying, okay, you have to sit out for your sport until you're cleared. That's their social network.
Tough,
yeah, that's what they're doing. A lot of times people might be recommending reducing screens. That's also their social network, right?
Yeah.
And so I think just we're really focused on not just, their physical symptoms and what they're presenting with, but how it's affected their lives and how their behavior patterns have changed and how people are reacting differently around them, because all of that influences how they're doing now.
We also see a big variety of either success or failure trying to get back into exercise and sports. Although some patients may not have really tried much exercise before coming to us, oftentimes they have tried to get back in and had increase in symptoms with that, and then either pulled back farther or tried to push through it and caused more symptoms. And so trying to find the balance of how much exercise to do can be really tricky. One other part of our clinic that we didn't mention initially is we have a fourth provider in our clinic, and that's an athletic trainer. Okay. And so all of our clinics are in a building with a gym. And so most of our patients, we recommend meeting with our athletic trainer about once a week and working on a gradual exercise progression. And this is probably the single most helpful part of our treatment.
Interesting.
It's just exercise as a therapy. And even though it's particularly helpful for athletes trying to get back in, there's also good research evidence that non-athletes, patients that are not trying to get back into a sport, also really benefit from using exercise as a therapy for symptoms after concussion.
Yeah, it's interesting. And we've heard some other stories of if you were an athlete prior to your injury, or if you were in good physical fitness, good shape, essentially, that you may have a better outcome, maybe because your body is tuned to dealing with challenge, or you're just more in tune with your body. Any credibility in that?
I think it can go both ways.
Okay.
I think certainly the motivation is there for athletes to get back into their sport. And so if we can work with a motivated patient who wants to get back in and is really doing the things, because we're asking a lot of lifestyle changes, whether that's water intake and exercise and food and sleep. So motivation goes a long way. But I think that if you have someone who's really used to exercising on a regular basis, it's almost farther for them to fall. That after a concussion and you pull back all that exercise, that's a bigger change for them from their normal routines. And that drastic drop in their exercise level can actually really kind of fester more symptoms in some people.
And I think the social and coping aspect too for athletes, right? So a lot of times, we've got teens, and especially who are athletes, their main coping mechanism is exercise, right? It's that sport. It's getting out there. It's getting on the field. It's being with their friends. It's having that social network. And so that can just lead to a big change sometimes for some of the athletes. And so, you've got this injury and all these new stressors that come on as a result of that. And then you're taking away their main stress coping mechanism, right? Which is sports and exercise and being with their friends and their team. And so in some ways, there can be a different type of, just stress and social impact of the injury as well for athletes that we see.
Truly unique to the person, right?
Yep.
So we talked about maybe there's a month that goes by before they come into you and having some of these life challenges. And on one end of the scale, you don't want to wait too long, right? If you've been out of school or you're dealing with these chronic symptoms. At the other side, we know that many concussions do get better on their own. How soon is too soon to know which path you're going to be on?
Well, the vast majority of kids get better within a month. So 75% of kids will feel totally back to normal within a month of their concussion. And at our hospital, we did a research study looking at a couple thousand kids who came through our primary care and sports medicine clinics. And the average time to being fully back to normal was 15 days.
Okay.
So, usually a pretty short recovery period. So we look at the trajectory. If you're only feeling 25% better and it's already been 2 weeks, then the likelihood of not really getting fully back to normal in a month is a lot higher. So, has there been a lot of recovery within the first couple of weeks? Are we heading in the right direction? I think if the answer is no, then it's time to start looking at other ways of addressing the symptoms, whether that's through a different clinic, multidisciplinary care, or different therapies like getting into physical therapy or exercise therapy.
And I would add, too, just the functional impact of symptoms, too, right? So it might be appropriate to seek a higher level of care if you're not in school at all, right? Because that is going to be unusual. 90% of kids are back to school full-time without accommodations within 10 days. And so if you're beyond that and you're still, not able to go to school every day or needing a whole lot of accommodations in school, then that's another sign that maybe we need to dig a little bit deeper.
So we talked in the last session about So this was our part one where we were talking about more moderate and severe, brain injuries that you want that structure that we've been talking about that, the kids might be taken out of because of that injury, and you want to get them back to it as quickly as possible. In managing concussion versus more moderates and severes, I'm sure there's some similarity, but I would imagine there's a lot of difference. Can you kind of tease apart what separates concussion from these more moderate and severes?
Concussion is essentially synonymous with a mild traumatic brain injury. So you have mild, moderate, and severe, and concussion is the mild one. So we think of concussion as if it involves loss of consciousness, it's less than 30 minutes. If it involves amnesia, it's less than 24 hours later that your memories are forming again. And if you come to emergency care, we use a scale called the Glasgow Coma Scale. It's basically how alert and interactive you are. And if you score 13 or higher on that, then it's a mild traumatic brain injury. So that's how we define it. And if you have a mild traumatic brain injury, then we kind of think of it as concussion and move towards, the initial, like Dr. McNally mentioned, a relative rest for the first day or two, and then really trying to get back into, starting to get into some exercise, getting back into school participation. Those things might not be possible with a moderate or severe TBI because that level of consciousness, that level of being able to interact, memory issues are really more likely to interfere in the more severe brain injuries.
And I would add too, I think a primary difference is we expect concussions to get better, right, fully, right, from a cognitive standpoint. And, for example, we don't expect a single concussion to be associated with any long-term cognitive impacts that we're measuring on sort of our typical cognitive tests. And that might not be the case sometimes for moderate to severe TBI, right, where it's, the management sometimes is more focused on coping with any challenges that might be lasting and persisting, whereas I think a good goal after concussion is for it to fully resolve, and we hope to see that.
Yeah, definitely different conversations that you're having with parents as well, or the patients themselves. If your goal is how much can I do for the rest of my life versus how quickly can I be back to my normal day to day. We've talked a little bit about athletes and sports related concussion, which of course is well known. Do you see folks in your clinic that have maybe different kinds of causes for their injury that we just might not think about?
Absolutely. We see a lot of kids injured in car accidents, other just kind of fluke accidents, falls from different heights, collisions. We've had injuries during a classroom setting from chair accidents and really any type of movement and some accident can cause a concussion if the impact is high enough.
We also see a decent number of assaults, too. I think that's, especially a population that doesn't always get thought of and also is at a higher risk, I think, for having persisting symptoms just due to the overlay of sometimes post-traumatic stress and other things that are going on. So whether that's abusive head trauma or assaults, fights and things like that are happening in the community.
Yeah.
Then kids who are preschool age, so under about 6, almost all the time it's from fall. About 85% of the time, the mechanism is from a fall for some reason. So really a different kind of population because most of those kids are not in sports to begin with, and so the care of those patients is quite different.
And they fall a lot.
Yeah.
Maybe just to tag on that, right? So a 5-year-old different than a 16-year-old. And with a 16-year-old, right? So maybe there's maybe they're driving or they're playing those sports or they're just doing different kinds of activities. Do you manage the concussions differently across the age ranges? If so, what are those differences?
There's very little research evidence for how to manage a concussion in under about 6 years of age.
Okay.
So almost all of the research has been focused on school-age children and adolescents and adults. And so, like most things in medicine, we kind of apply what we know to a different group and kind of assume that it'll work in other groups. In young kids, though, that might not necessarily be true. The daycare setting is quite different than the school setting. And asking, a 3-year-old to not run around and climb on things is a lot different than expecting a 16-year-old to not go back onto the sports field. Also, even in just gauging symptoms and tracking symptoms, young kids just can't really report their symptoms very well.
Yeah.
And so we have to rely on parents to observe either symptoms or signs that their child is experiencing those symptoms.
Parents are a big part of this, this recovery pathway, regardless of the age, but especially as you get to those younger ages. What would a parent need to do as they're kind of monitoring a younger kid? What are they looking for?
Well, so in young kids, we want to first protect them from being injured again while they're recovering.
Yeah.
I think we can expect them to not, climb up into trees or on ladders and things like that while they're recovering. But if we try to hold them down too much, then you may cause other symptoms and just frustration and kind of acting out in other ways. Some of the more common symptoms we see in young kids are, in addition to just the standard, headache and light sensitivity and dizziness and things like that, we are seeing a lot of behavioral changes. So increased fussiness and clinginess, and decreased independence in their activities, maybe sleep changes. Sometimes we've even seen some regression in their skills. So, regression in their speech skills or potty training. So some unique symptoms that we might see in young kids. But what parents would want to look for is, are they supporting their kids in trying to improve those symptoms? Are they understanding that their child might act a little bit different and need some more support while they're recovering? But also not to change their entire life to the point where they're trying to get back to normal, but in a totally different environment either. So it's kind of that balance of both supporting them, but also kind of expecting some normal life schedules and routines to continue.
It sounds like that's something that, each family is going to have to navigate. What's normal, what's an appropriate shift or tweak to the way that we do things, what's normal for this kid's behavior versus, something that may be particularly abnormal.
Absolutely. And speaking of those routines, we did find when we looked at younger kids with concussion that those kids that are typically in a daycare setting tended to recover a little bit faster than kids that were not in a daycare setting.
Interesting.
So under age 6. So it could be that those kind of routines and scheduled days are maybe beneficial for recovery.
Yeah, I was just going to mention when you were talking, I was just thinking about the Goldilocks principle with concussion. You want them to have some increased support, but not go overboard with everything. And we think about that a lot just across the ages, is really just this not too little, not too much with everything, right?
Just right.
And that's hard, right? And like you said, that just right is going to look different for different kids.
Okay, so with the younger kids, right, how do you stop them from climbing on things? You want to avoid that potential second or third injury. Do you see that with the clients that you have that are coming in with these persistent signs? Have they had a concussion before?
That's a really, really tricky question to answer, because I don't think we know exactly what another kind of minor impact after a concussion means. So we do have a lot of patients who are recovering from a concussion and then, bump their head in other ways. And even though that additional bump may not have been enough to cause a concussion itself, if the brain is recovering from an injury, is that enough to kind of exacerbate symptoms to the point where it's going to delay recovery a little bit farther? So there's that aspect where, it could worsen the injury some. But we also, see some kids that have such a minor bump after their concussion that, I think that can even set in other drivers of symptoms, like a panic reaction. And so it may not even be a physiologic, changes within the brain causing a concussion, but more of a stress reaction to being bumped again. And since we don't have a test to show what's physically going on in the brain, what those electrolytes and chemicals are doing, we don't have a definitive way to know, how severe that impact was and whether it caused, changes within the brain or more of a stress reaction.
Yeah, I think, a lot of times some of the early education is about the dangers of getting a second concussion while you're still recovering from that. And so, and there's a good reason, I think, sometimes why that kids are provided with that education, because we want to make sure they're taking it seriously and not just, ignoring the recommendations not to, go back into contact sports too soon. But on the flip side, that can be really scary, right? When you're afraid that if you get bumped in the head again, that there could be, if in their mind they think there could be some type of catastrophic consequence of that, then if they, bump someone in the hallway at school, that can be really scary, right? And also they're, thinking back of, how bad the symptoms were when they first had it, and they don't want to go through that again. And so that can also trigger a big emotional response and stress response as well, even when they have a small hit. And again, we don't know, as much as we would like to know about just biochemically what's happening when they have those smaller hits, if they're still in that vulnerability period.
In all of this, they're not just interacting with you, right? They're interacting with the home life, they're interacting with the school, their social environment. What are things that you feel like are out in the community beyond the clinic that people should think about in terms of as a resource or as sort of a support that they could lean on?
I mean, I would first off say school. There's especially in Columbus City schools, there's a great return to learn program.
Mm-hmm.
There's just at most school districts, there's going to be a plan and a program and something that you can sort of just lean on the supports that are there at school as well as your medical provider. So I think a lot of times people might not even tell if it didn't happen at school. They might not think to tell school that it's happened. And so there's a lot of times where we might see kids where they haven't even told the school and they're not getting any type of accommodations. There's no supports in place with them. So I would say first off, one of the first things after you have your first medical appointment is to share that information with school, share that letter with school, and come up with a return to learn plan.
There's this sense of, they come to your clinic, right? And then they're going back out into all these places. You're talking about what is that plan, communicating with, all of the parties really involved. And they're still probably going to be managed by some clinical team, whether that's just kind of going to their primary care appointments or something else. How does that all work? I mean, do you feel like it's easy to work with their home doc or their school nurse or their athletic trainer? What's the level of awareness of concussion and brain injury in those types of roles?
I think in general, the awareness of concussion is really great. I mean, every state in the country has a concussion law, and those have existed now for many years. And so I think the general awareness of what concussion is and how it should be handled carefully is pretty widespread. Now, do kids still, especially if they're trying to remain in a sport, maybe hide those symptoms and not get diagnosed? Well, sure. But I think overall, kids are looking out for each other, parents are looking out for injury, and so the awareness is there. The recovery then is, like Kelly mentioned, getting back into school participation. And when you get back into sports participation, one of the laws in Ohio is that they have to have clearance by a medical professional. Mm-hmm. And so that's usually a physician, but it can also be an athletic trainer working in concert with a physician. And so most high schools have an athletic trainer that is very knowledgeable about concussion return to play protocols and how to get kids safely back into play. And so after a diagnosis of concussion, a patient may, if they're working with a primary care doctor, let's say, they may be released to start a return to play protocol, and then they work with their high school athletic trainer. Or if they're, below that, grade school or earlier, they may be working with their parents and coaches directly on, doing several steps to ensure that symptoms are not returning and that they're tolerating that type of exercise before they fully go back into a contact situation.
It sounds like, okay, so the awareness is there, right? And the law is there, which is great. You've got a likelihood of being able to go back to your normal life, either directly with not a lot of support needed, or with clinics like yours that can kind of put together a good plan, bring all these people together, and then get them out there. And there's some good advice here for parents. It sounds like we've got this all buttoned up. Is that true?
We wouldn't be as busy as we are in our clinics if that was the case.
So I guess the question is, like, what do you feel like is sort of still missing in this approach, or things that we just don't know enough about? What's sort of that future work look like?
I think that sometimes protocolizing things too much can be detrimental. Oftentimes when we're talking with our patients about their return to school or their sport or other activities, we want there to be some flexibility with that. We can't say, okay, if you do this, then you have to do this next, or you can't do this unless you do 20 minutes of this before you do 25 minutes. We're kind of giving a rubric, kind of a guideline for how a progression back into school or exercise may work. And there needs to be some flexibility with those programs to be able to account for that. And so when we hear things like, we've had patients that say, I'm not allowed to step foot on my practice field until I'm fully cleared. Well, that's actually not going to work, because to get fully cleared, you have to do some drills and some non-contact practice before we clear you for contact. And so that is an example of something that's been kind of taken a little too far into not necessarily a law, but kind of a policy for that school. Same thing with school participation, where we can't necessarily say, okay, for these next 5 days, you have to do this at school, and then you can move on. We want there to be like a everyday kind of discussion with, how did they do yesterday? What are they able to tolerate the next day? And the school, we want them to be able to adapt to that.
I was thinking of an example with schools, right, where sometimes people will write, providers will write an accommodation letter, which is very, necessary and well-meaning, but it might say something like no screens. And with no end date and just no screens in school, that's not going to work, right? I mean, that is what school is. Or say no tests. And so then they're having a month where they're mostly back to normal, but just not taking a test for a month. Then they have 5 tests to make up. They're stressed about that. But maybe take the test, but with breaks, or take the test, but, redo it if you make a mistake, or things like. So it's just that flexibility, and it's hard to just sort of navigate that. And then one of the studies that Sean and I are working on is qualitative interviews of athletes who have retired from sports due to concussion. And so part of our goals in doing that is just hearing from the athletes of just what that experience was like, what went into that decision, and how that decision affected them, not just, physically, but how that affected all aspects of their lives. And one of the things that we learned, and we interviewed kids from lots of different states and lots of different sports that they were doing. And one of the things we heard about is kids who had to retire from sports due to some type of law or policy saying, okay, 3 and you're out, right? Or 4 and you're out. And that had a lot of negative impacts sometimes on the individuals, because they might have been afraid to seek care because they knew if they had that concussion, documented, that then they might be told they had to go out, even if, say, they recovered and they really didn't have a huge risk for having long-term problems. So I think that was an example of a policy that I think could have some negative impacts if it isn't implemented based on how that one individual is recovering and the factors that are important for deciding, the risk benefit for that one person.
So in some sense, what you're looking for, and I like to phrase these as like green flags and red flags. If you're out there, again, you have a fantastic clinic and a fantastic organization that's not always available to everybody. So if somebody's out there looking for a provider or a team, or at least an approach, are we thinking about flexibility and kind of tuning that as a green flag? What are other green flags? What are other maybe red flags that you would want to be careful about?
I think for kids that are returning after concussion, you want someone who's experiencing pediatric concussion. So that, the things that kids deal with as they get back in may be different than what adults deal with. Other green flags may be just seeming reasonable, and that actually goes a long way. I mean, if you come to a first visit and your doctor is saying, well, this is your second concussion, so you have to be out for 6 months. where's the evidence behind that? What is the reason for that? Or if they say, well, you can go back into your game tomorrow without having gone through a return process, that's also not very reasonable. So I think a lot of once we talk to our families a lot in clinic, a lot of the feedback we get is like, oh yeah, that makes sense. We're not really doing anything that different or unique. We have just a very reasonable approach to what we're recommending, and I think a green flag would be just do you feel comfortable with, and does it make sense what your doctor is saying, versus something that seems kind of off to the side and maybe one angle, but not really a comprehensive angle.
Yeah, and there's a lot of fear out there with concussion, and you can see that. And I think that leads to just sometimes going over the top. So my niece recently had a concussion, and so it was interesting seeing it more from like the personal angle as compared to a patient. So my niece is 15 and she's a ski racer. And she had a concussion, and I feel like my family knows we talk about concussion a lot. They're athletes. But just, talking my sister down, the amount of anxiety and how scary the symptoms were she was feeling. So we had a FaceTime, and I'm, teaching her deep breathing because what she's experiencing was totally normal and kind of really, fit exactly what we would expect going through it. But in that moment, my sister's freaking out, she's freaking out, and there was just so much anxiety about it. And they were told to avoid screens, for example. And so then my niece was like, but I sent a text message to my friend, like, is this going to damage my brain? And so that just fear, it was real. And I think there is a lot in the media and just a lot of, just general fear that there's, that you're going to do something to your brain that's never going to get better. And that can really drive a lot of your symptoms as well.
I think oftentimes with fear, though, comes unrealistic expectations for a recovery. And so maybe another red flag would be kind of going to whatever kind of clinic it is that's, they're a hammer, and so everything they see is a nail. So if there's one simple treatment or therapy or something that's going to fix everything, that's probably too good to be true. We're pretty used to having a treatment plan that has 8, 9, 10 different points to it, because one thing alone is not really going to improve the symptoms, because there's usually multiple things going on after a concussion.
And people are looking sometimes for that magic bullet, right? They're looking for, if I could do this one thing and that would just make all of my symptoms go away, I want to do it, right? Because I'm afraid it's affecting me. It's really negatively impacting my life. And that's just usually not the case. And so if you've got someone promising that, that's probably a red flag as well.
I mean, it makes sense. And it sort of gets to the point of you want that something simple because you don't have time. There's so many other things to do. You just want to get back to your normal life. I get that. But then also a 9-point plan, right, can feel overwhelming. Do you try and, prioritize for families based on what they need? How do you kind of figure out what part of that plan is best for them if they can only do part of it?
Yeah, I mean, so we're trying to a lot of the things we are recommending are kind of important for just general lifestyle. So, one point of the plan might be drink more water. One point might be start eating breakfast because you've been skipping that every day. So, these aren't really drastic things, but, we are asking our patients to change some things about their life. And, most of these things would be general improvements to their health. It might be a medication for headaches. It might be coming back in for physical therapy once a week, or working with an athletic trainer, or doing some counseling. So, we do certainly recognize that these treatments might be pulling them out of school. And so we try to prioritize getting them all in the same morning if possible. So they're not like missing this morning and then that morning and then a later afternoon. So we try to balance that, how much can we do, but not pull them away from school and other parts of their life too much.
And that's often, I think, what I'm doing too, where we might say, okay, you need to do all these different things. You need to fix your sleep. A lot of what I do in the clinic is helping them make the changes that we're recommending just more doable and more feasible and meeting them where they're at, right? If we're saying you have to change a million different things, let's prioritize what's one. Or how can we problem solve? We're saying, okay, you need to exercise 5 days a week, but I don't have somewhere to go to do that, right? So it's really problem solving, meeting them where they're at, trying to prioritize some of these recommendations as well, because recognizing it's hard what we're asking people to do.
So you talked about the retirement study. What are the things that you're interested to explore in this space?
Yeah. So one of the things I'm particularly interested is in behavioral interventions for kind of addressing some of the difficulties that people might have if they're having persisting symptoms. So we've developed a brief psychological intervention program. So it's, again, meant to be relatively brief and doable. So 4 sessions. It starts with psychoeducation about concussion, dispelling myths, giving them information about what's happening with concussion and how to best manage the symptoms. Then a big piece of it is working on their sleep. So it's sleep intervention. So what behaviors should they be changing to help improve how well they're sleeping? Then there's a relaxation training component. So again, to try to help mitigate some of the stress response that can occur physically after a concussion. So teaching them things like deep breathing, relaxation strategies, and then cognitive restructuring. So to try to target some of the negative thinking patterns that might be going on after a concussion and try to flip those to think more positively and have a more positive outlook about their recovery. So what we're looking at is if we add that psychological intervention to the other pieces of their concussion treatment, does that help, their overall recovery?
And this is even more elements of just let's get them on the right plan and the right trajectory so that they do have that recovery pathway. They're also aging, and at some point they're no longer a child or an adolescent or a teen or however you want to define that endpoint. Do you see things as you follow folks as they age that crop up later in life because they had a concussion? Is it easy to tie things to that, or is it sort of life and health are complicated and it maybe plays a role or not?
I think more of the latter. There's very conflicting research on the potential long-term effects of a single concussion or even several concussions. Mm-hmm. So if you looked through the research that's been published, you could find data that supports the idea that there's some long-term difficulties in some patients after concussion. Other data doesn't really support that. The same can be said for subconcussive impacts. So far we've been talking only about concussion, which is usually a single injury. It's diagnosed because of symptoms that are produced. Subconcussive impacts are, the multiple hits that you might get in sports or other recurring situations. And most of the research that's looked at long-term problems has primarily focused on subconcussive impacts. And that research is quite mixed as well. We did do some research in youth football players where a couple years ago we monitored kids ages 9 to about 13. So we monitored 4 years in a row of playing tackle football, and we monitored head impacts throughout every season. And we did cognitive testing and behavioral assessments before and after each season. And then we tried to correlate the amount of head impacts that they took with their performance on these tests. And we didn't find a correlation between those two. So, the kids that had a lot of head impacts did not do worse on the cognitive tests or the behavioral assessments than the kids that took very few impacts. Now, we were only monitoring for a 4-year span. And so we couldn't really fast forward 40 years to look at how they're doing later in life. And other research studies have looked at retirees and ex players, and so that's kind of the other end of the spectrum, looking at decades later and trying to correlate their exposure from earlier in life. There has as you can imagine, there has not been a study that's looked at the exposure time all the way through retiring age, and that's the only way to really definitively know a causality. But because of the challenges of looking at this topic, there's just a lot of mixed messages and mixed evidence on this topic.
And I will say that, in our qualitative study, talking to athletes who have retired, what was it? Almost half of them, maybe more than half of them, were afraid that they were going to get CTE.
Yeah, that's kind of where I was going with this. That's got to be in the mindset.
It is. And so I think even though, we don't think probably the majority of those athletes are maybe in that category, it's on their mind, and a lot of them think that that's inevitable almost. And so that has a negative impact as well. And so I think sometimes we don't always think about that other side of just when you're going through this and the fear that something like that is going to happen to you, and that's weighing on folks as well.
And certainly a healthy lifestyle and things along those lines are going to be, if nothing else, going to reduce your likelihood of those kinds of outcomes. And that's sort of what you're building into your plan, right? That better sleep, exercise, I'm sure nutrition, right? That social participation, all those kinds of good things that are generally good health, right?
All those things are protective for, lowering your risk of dementia and neurologic complications later in life. Absolutely.
This has been a great conversation. I really appreciate it. Doctors McNally and Rose, thanks for coming in.
Yeah, thanks having us.
Thanks so much. It was great talking.
Thank you so much for listening to NeuroNights. This effort is sponsored by the Center for Brain Injury Recovery and Discovery at The Ohio State University and is supported by our partners, Buckeyes Raising Awareness in Neuroscience and the Ohio State Wexner Medical Center. Each month, we release a podcast episode about a brain injury topic. We host a virtual live Q&A with our podcast guests, and then we host another virtual session with the brain injury survivors sharing their story. Please find more information about this effort at go.osu.edu/neuronights. Sign up for our emails there and be on the lookout for live Q&A details with our podcast guests. You can find us on Spotify and YouTube to listen to previous episodes. Join us again next month.